Just to introduce myself, I'm Wylie. I'm lead officer of Hepatitis Scotland, who are hosted in ScottishDrugsForum, but I'm also co-chair of the National Sexual Health and Bloodborne Virus Prevention Leads. And I also manage the National Development Officer for Harm Reduction and Death Prevention, who recently produced a strategic document and program on staying alive in Scotland, strategies to combat drug-related deaths. So I've got a keen interest in both reducing morbidity and mortality. The title of today is Innovative Approaches to Reduce Drug Deaths and Harms, but the first slide from the team publicising International Overdose Awareness Day perhaps encapsulates the whole thing for me, a time to remember, but a time to act as well. And as this is International Overdose Awareness Day, I'd first like to have a moment's silence for those who didn't recover from overdoses and for those around them who this has impacted greatly on. The images on the slide are of models, but they're chosen to represent the diversity of those who've come to harm from drug use. 706 drug-related deaths were registered in Scotland in 2015. That's 93 more than 2014. Can we stop this from sliding through in times? This is the largest number ever recorded, and 370 higher than in 2005. So essentially in 10 years, the number of drug-related deaths have doubled in Scotland. A front page story on this in the National said, for every drug user whose addiction proves fatal, there are dozens more still living, or at least existing, in our communities. It is shocking and shameful that drugs were a factor in more than 700 deaths last year, but for every one of these deaths there were more than 80 further problem drug users in Scotland, defined as those who misuse opiates or tranquilizers, and often both. And for each of these individuals, there's a whole circle of others, neighbours, parents, siblings, partners, children, whose lives are also blighted. In Glasgow today, statistics match or beat the national ones in drug-related death, but also in other key health areas for drug users. In 2015, there was a 500% increase in HIV incidence in people who inject drugs. Injecting drug use was the #1 route of infection of all new cases of HIV in Scotland, the first time since the 1980s, since the first wave of heroin then. Since I've been in Scotland, and hopefully this is not related, of course, we've had outbreaks of botulism, anthrax, group A strep and HIV, and along with the ever-present hepatitis C. Tabloid media often portray problem drug users through a criminal justice lens. Evidence-informed practice must continue to reframe drug taking as a health problem rather than a character deficit, and look for our solutions within that frame. We've got 61,500 people in Scotland with a drug problem, and less than half of the people in this group are in treatment at any one time. An Australian study recently found that 90% of drug-related deaths are potentially preventable, but systems and services continue to fail to prevent this. We know that being in effective treatment not only protects people against dying of an overdose, but also facilitates other health interventions. As Thilo will show later, high treatment coverage actually decreases diversion of opioid replacement therapies as demand decreases across the whole group. The evidence presented today will be clear. The outcomes have been supported through providing effective treatment and care services based on a clear, evidence-based vision of what can be achieved and how. A number of countries have reduced overdose deaths to very small numbers. In the Netherlands, Hep C incidence over the last couple of years has been negligible and virtually non-existent. In 2014, Europe counted 88 official drug consumption rooms in 8 countries: Denmark, Germany, Greece, Luxembourg, the Netherlands, Norway, Spain and Switzerland. Heroin Assisted Treatment programs are running successfully in 6 different countries. ScottishDrugsForum has long supported the development of supervised consumption facilities and heroin assisted treatment, and this conference was organised today to highlight the why, the evidence for using these measures, but also to demonstrate the how. It's also important to ensure we differentiate between the two models presented today, as they're very different beasts in many ways. Supervised injection facilities are very much a public health approach, taking into account timescales and ways of working that appeal to the person using the service. With harm reduction, health promotion and engagement, key facets of attracting a wide audience to prevent things. Heroin assisted treatment, however, is a much more medicalised treatment approach for a much smaller audience of long-term users that other treatments such as methadone, buprenorphine, etc. haven't worked for. We've got an exciting program of experts today, international and homegrown, including a recent addition to the UK Knights in Shining Armour. Congratulations, John, on your recent knighthood. And a fellow Antipodean who may be finding that although it's bad enough watching the Olympics in Sydney, it's much worse being in the UK in the aftermath. These presenters will share their expertise with you as they demonstrate and explore the practicalities of these proposed measures. Growing up in poverty is strongly correlated with problem drug use. Cracking down on dealers doesn't express why they found so many customers to begin with, why so many people feel hopeless, alienated and disenfranchised. The recent statistics of real people dying represent a challenge to our image of ourselves, but also an opportunity to show that we, as a society, care and are prepared to take steps that protect the most vulnerable. The preservation of life should be a primary aim for services. It should also be a national aspiration. It's a national tragedy, it really is. This many numbers. You know, what other things which have doubled in 10 years wouldn't we have people crying out across the media? There's been limited response to the last figures. And it's a national tragedy as well as a personal tragedy for individuals, friends, family. The statistics are ultimate indicators of Scotland's continuing health inequalities. And these are just the way that it's reported in the media. Deaths are reported in the media, and we look at the descriptions that we use on them. But when we look at the inequality and things like that, this from Alex Stevens is a particularly interesting graphic, and I really hope Phil's enjoying the meet.